Good morning. Here we are at the spring Representative Assembly of the Saskatchewan Medical Association for 2014. And it is spring. It's a season of hope, of new birth, of rebirth, of renewal, of inspiration, and of hard work for Saskatchewan. I'm really feeling rejuvenated by the prospects of the year ahead. We will have a new CEO. We will have a new SMA office in a new building on Airport Drive in Saskatoon. We will have a new SMA strategic plan, which you will have early input to, as we are still at the Rep Assembly, and then the board will work on in June at our retreat. We'll have a new dean at the College of Medicine. We are designing new hospitals and new ways to work within them. We will have new patterns of physician engagement in this province. At the beginning of this year, I challenged physicians. I said, we need to lead. We are leading, and we're learning to lead better. Many physicians have stepped up and are working hard in their clinical practices, in their hospitals, in their health regions, and for the many provincial initiatives that are now underway. We and our patients are learning to choose wisely. We, our patients, and our colleagues in healthcare are learning to lead. We share ambitious goals. As we struggle to reach them, we recognize that no sector of the healthcare system can succeed without the help of every other. We learn about flow, into and out of emergency rooms, for example, and recognize that all of our upstream and downstream pressures must be recognized and dealt with appropriately to allow any lasting improvement in any specific area of focus. We are well motivated to better care for our seniors, whether they be in their own homes or in our long-term care facilities or needing end-of-life palliation. We are acutely aware of the need to help our patients with mental health and addiction problems. We understand the effects of the social determinants of health. In Saskatchewan, those are immensely important with our First Nations people, with many of our rural communities, and in our cities. We also recognize that we, the physicians of Saskatchewan, need support to persist in our leadership roles. We continue to have the second lowest physician-to-population ratio in Canada, second only to PEI, and their population is clustered in a much closer area. We need good locum relief to allow doctors temporary absence from their clinical duties so that they can take part in improvement projects and transformative change so that their patients are not disadvantaged. We need to maintain that patient-first focus, and as doctors take on other leadership roles, those patients need to be well cared for. We need truly collegial and collaborative working relationships with non-physicians, with other healthcare providers. The SMA will continue to work hard to win these supports and to recognize the changing needs of our physician members. We all know we are stronger when we talk with one united voice. The SMA is that voice for physicians in this province. And I love alliteration, I must say. I was thrilled when the minister said that Clare is a clear clarion voice. I wish every physician in the province could be a clear clarion voice for not only our interests, but obviously the interests of the health system in general and every single patient. The SMA speaking for physicians in our province includes more than negotiating with the government. It includes speaking on behalf of the profession in the media, and the media are interested. It includes representing members and standing up to health regions, and making other healthcare groups aware of why they need to collaborate with us, work with us, and not try to replace us. When the SMA stands up and demands physicians be respected, when the SMA is vocal in the face of some impropriety or poor policy, it's not only the physicians who benefit, but our patients. One of the subjects we've been most vocal about is advocating that all people in the province of Saskatchewan have access to a family physician, or at least easy access to a team which includes a family physician. While we have made strides in reducing surgical wait times and working on strategies to eliminate emergency room waits, recruiting and retaining more family physicians may have not been given the same priority. If we are truly committed to delivering better primary care, if we really want to decrease those emergency room waits, having more family doctors is essential. The aging population will also demand more physicians in order to properly monitor chronic diseases and advanced healthcare decisions. More often than not, having that right care in the right place, delivered by the right provider, means that there needs to be a family physician in that mix. We recognize and accept that primary care includes delivery of care by nurse practitioners, therapists, and pharmacists as part of the care team. But physicians are intensely educated. They're care providers with knowledge and training to properly oversee, diagnose, and monitor complex conditions, conditions that are often not apparent to others without the same level of training, education, and experience. It may come down to a matter of patient safety. Convenient access does not take priority over an informed diagnosis and follow-up care. We are asking in our next agreement with the government for items that will position the medical care system to respond to Saskatchewan's growing population and its medical needs. These include fee improvements to keep pace with rapidly rising overhead costs. Physicians ought to be able to maintain their standard of practice and not be disadvantaged by the boom that's happening in the economy of Saskatchewan otherwise. Fee improvements need to keep pace, and we need to be in a competitive position with provinces on either side of us, and of course that BC one with the lovely coastline, to be in a good position to continue to recruit and retain physicians. We're also seeking new collaborative care codes that would support physician-initiated contacts with allied health workers, support nurse practitioners in our offices, respond to those questions that we heard at the microphones this morning about how we can best utilize all the skills of all the non-physician providers we have in teaming up with the physicians so that we do achieve that appropriateness and accountability aim that's so vital. If we could expand the list of work that can be billed when provided by clinic staff working in collaborative family practices, that will really help. Another point we put forward to government is something I think is especially important, and that's the key part of our current work on appropriateness. Our last RA theme was appropriateness and accountability. And here we're not talking just about an individual physician's variability in his practice or her practice or compared to the rest of the profession. We're talking about the system accepting responsibility for the policy and the funding. We're also talking, instead of using bylaws to control utilization or staffing, we need to take responsibility for those decisions on a regional basis, on a provincial basis, and keep separate bylaws that allow practitioners in any region to be protected, but to be disciplined, and to play the role they rightly need to. They will help with accountability. They ought not to help with utilization. The SMA is willing to partner with the government on a review of appropriate care, provided that an acceptable structured evaluation process is in place that involves our specialty sections and our local specialty groups. We also feel that there should be some sharing of system savings achieved in those changes to address other priority areas in the physician budget. The doctors of Saskatchewan are already doing their part. We're continually examining, reevaluating our practices, upgrading our skills, using new tools. In fact, it's a requirement of our licensure to maintain our continuing medical education. We have embraced new tools to improve the monitoring of chronic diseases and to improve the efficiency of our healthcare system. When the Choosing Wisely Canada campaign was launched, the SMA was already on board. We've been talking publicly about it months before the Canadian launch. We began promoting the appropriate use of tests and procedures, not only to provide efficiencies and savings for the health system, but to limit patient exposure to radiation, for example, or to other tests which provide little or no value in arriving at a diagnosis. If you haven't already looked at the Choosing Wisely website or the other Choosing Wisely materials, I encourage you to do so. We often become used to ordering a particular test or particular therapy when certain symptoms are present. And while this test may have been acceptable when we finished training or even 10 years ago, it may no longer be. It's incumbent upon us to know the current standards and practices and to make sure that we are caring for our patients and caring for the health system optimally. I recently wrote on the topic of privileges, professionalism, appropriateness, principles in the SMA News Digest. We have the privilege of being invited into the intimacy of our patients' problems, and we're allowed to interview in very critical moments of illness, birth, and dying. We have the privilege of working in a province that takes healthcare seriously and has said for years that no good change will happen without physician involvement. That's a benefit that really needs to be recognized. And when I go to national meetings, whether they be in Ottawa or elsewhere, I am so pleased to be able to compare our relationship with our Ministry of Health and our government with those very dysfunctional relationships elsewhere in Canada. We ought to be proud. If we want to maintain our privileged position as leaders of the healthcare system, we need to be on the cusp of innovation. I have to stray from the words too. The very first time I had the privilege of meeting the Federal Minister of Health shortly into her portfolio, Rona Ambrose said, "Oh, Saskatchewan, that's the place for innovation." That's the first thing she said to me when I met her. Isn't that a great reputation for us to have as doctors? We need to show the importance of addressing current and future issues head-on. Just as physicians know that the human body transforms with age and their practice needs to change based on a patient's needs, symptoms, and lifestyle, they also know that the healthcare system needs to change. As the population ages, as the economy transforms, and as new technology becomes available. I'm very confident that the SMA and the physicians of Saskatchewan will be those to lead the change and stand up for the needs of our patients and our population, and for the needs of our profession. We've spent the last few years building a really good foundation for engagement and for physician leadership. I'm excited to see the progress we make in the near future as the SMA paves the way for better care and a strong and stable practicing environment for all of Saskatchewan's physicians. This is my last day as president. I would like to thank you. Thank the physicians that you represent as well for the privilege of serving you, the Saskatchewan medical profession, this past year. I've done a lot of traveling and a lot of meeting meeting with you and meeting for you. I found that talking to doctors is a lot of fun, but listening to doctors is invaluable. Doctors, continue to make your voices heard.